The first session is going to start with Dr. Lu Chen, one of our experienced dermatologists, who's going to talk about risk factors and diagnosis of cutaneous squamous cell and basal cell carcinomas. Lu, the floor is yours.
So much for the introduction, Jeff, and thanks again. It's my pleasure to speak to you all this evening about cutaneous squamous cell skin cancers and basal cell skin cancers. So I'll be focusing on risk factors and diagnosis for these cancers. Next slide, please. So both come from keratinocytes, which are the primary type of cell in the outermost layer of skin, or the epidermis. Next slide, please. So these keratinocyte cancers are the most common cancers worldwide and are more common than all the other cancers combined. The lifetime risk of one of these cancers in the US is about 20%, which is approximately 1 in 5 Americans. And the incidence rate has been increasing over the past few decades, predicted to continue to rise. Next slide, please. So what are the risk factors for basal cell skin cancers, BCCs? Older patients, men, people who have fair skin. Basal cell skin cancers are less common in darker skin because the melanin, which is what gives your skin color, protects your cells from the sun. So it turns out that adamantium doesn't protect your skin from the sun, neither does the force. So celebrities are just like you and me. They get skin cancer too. We are big fans of wide-brim hats, though that's something that we do love for our sun protection. Next slide, please. So as I alluded to, BCCs are caused by sun exposure of UV damage, especially intermittent and intense sun exposure. So that could be from tanning bed use, outdoor activities like tennis or golf, sunburns, especially in childhood as opposed to adulthood, or if you've had radiation in the past, usually many years ago, for a different kind of cancer. Next slide, please. So what do BCCs look like? So classically, they're pink shiny bumps that bleed. They can have a sore in the center, such as on the forehead here or near the eye. They can be skin-colored bumps or pink scar-like areas with a little depression in the center. Next slide, please. They can have color and be more brown. They can look like sores that don't heal, like on the ear or the arm here, or they can look like pink scaly areas like on this patient's temple or on the shoulder. Next slide, please. So let's say you have a spot that looks like this and you come see a dermatologist. How do we diagnose skin cancers? So we'll look at your skin. We might use a device like this called a dermatoscope, which helps us see deeper into the skin and can help us spot early signs of skin cancer. Next slide, please. And when we find something suspicious, we'll recommend a skin biopsy to confirm the diagnosis. So we'll clean off the area and numb it up. Next slide, please. We'll either take a thin layer of skin around and underneath the spot, like a little scrape, or next slide, please. We might use a tool like this, kind of like a little cookie cutter tool, to take a cylindrical piece of skin. And next slide, we'll put in a couple of stitches. Next slide, please. So we'll send you home with a bandage, and we will send the specimen that we just collected to the lab. Next slide, please. And they'll process the tissue and make these slides. And then someone like me, who also specializes in reading slides, issues a pathology report with the final diagnosis. Next slide, please. So for example, some of these pink spots that we talked about, this is what you might see under the microscope. This is the classic look of a basal cell cancer under the microscope, these bluish areas with clearing around it. So basal cell skin cancers are usually slow growing. They stay in one place, can get bigger, destroy normal skin. They can bleed and become bothersome. They usually don't go anywhere else in the body or metastasize unless they're neglected for many years. So moving on to a skin cancer that can be a bit more aggressive than a BCC, it takes us to our cutaneous squamous cell carcinomas, CSCCs. Next slide, please. The risk factors for these skin cancers can be similar to that of BCCs, so sun exposure, tanning beds, similar to BCCs. Can also have other environmental exposures, for example, exposure to arsenic, which you can find, for example, sometimes in well water, other chemicals that you can find, for example, through exposure to coal tars. Another thing that increases your risk of CSCCs is if you have a weakened immune system. So this can be if you have had a solid organ transplant, for example, heart transplant, kidney transplant, you take medications that suppress your immune system, or if you have leukemia or lymphoma and you have a weaker immune system than normal. If you have a chronic wound or chronic inflammation, that can also lead to SCCs, or infections like HPV, human papillomavirus, which is the wart virus. There are certain strains that are more likely to promote skin cancers. Next slide, please. So what do CSCCs look like? So here on the top left, a red scaly patch, this is the classic look of a squamous cell carcinoma in site 2, which is the earliest stage of CSCC. It's just in the top layer of skin in the epidermis. These skin cancers also have color. They can look brown, almost like an age spot, like here on the lower left. As they invade into the next layer of skin, they become more raised. They can look like a red scaly bump, such as here on the ear or on the nose. Next slide, please. These skin cancers can get very scaly. So for example, here on the top left, you can almost look like you start developing a really scaly spot that almost looks like an animal horn. They can be crusted lesions like this one on the lower left on the lip, can be on the scalp. They can affect the nails, for instance, on the top right. Sometimes they can look like warts, and maybe that's how it started, but you can also get squamous cell skin cancers around the nails. You can also get them in areas you see less sun as well, such as under the underwear. Next slide, please. So if you biopsy a spot, a squamous cell, a CSCC, you might see something like this on the slide. So here in the center, you have these pink, really atypical, abnormal looking cells, these masses of these cells. And you can see this tumor in particular is very large and very deep. Next slide, please. And that those are higher risk features that we see under the microscope. Other things we can look for are what's called poorly differentiated pathology. So if something is well differentiated, that means it tries to look like or mimics normal skin, where if it's poorly differentiated, it doesn't do so, and it's usually, that's associated with worse behavior, bad behavior. Other high-risk features are if the tumor involves nerves or grows into fat or bone. So if you have a SCC with one or more of these features, we'll have a higher stage. And the staging system is something that we use and when we start to think about prognosis or treatments for these tumors. So, these cancers are much easier to treat when they're small. Next slide, please. So what can we do to catch them early? Well, we recommend checking your skin. So you can check your skin at home. It's called a self-skin check, or you can come see, have a total body skin check with a board certified dermatologist, especially if you're a patient at higher risk. That's something we recommend. Next slide, please. And how do you prepare for a total body skin check, and what do you expect? So we'll have you change into a gown. The visit will be focused on your skin exam and kind of a thorough check from head to toe, looking for anything suspicious for skin cancer. So, do wear your hair loose so we can check your scalp. Spray tans are okay. Don't wear any nail polish so we can examine the nails. Don't wear makeup or bring makeup remover so we can examine the face. And make sure we take a very good look all over. And next slide, please. Some resources that can be helpful. AAD.org, which is the website of our American Academy of Dermatology, our professional society, has a Skin Cancer Resource Center. They have a variety of resources, including how to perform a self-skin exam. And AMAT Skin Cancer Foundation is also a great resource, and thanks so much to them for helping run this great event. And that's all I have. Thanks so much.